that we are a jurisdiction that respects reproductive rights and acts to protect reproductive rights for British Columbians, and that we take care of people regardless of how much money they have through our universal public healthcare system. So these are proud and competitive advantages for us, and it is driving interest from American healthcare professionals. And we have some increased evidence for that. Just in early April, we made significant changes to how American-trained nurses are able to get to work in British Columbia, cutting the wait for nurses from up to 4 months to a matter of days being able to get to work here in the province. Since that early April implementation date, we have seen some significant impacts. Applications from U.S.-trained nurses to British Columbia are up 127%. 177 nurses have applied since the implementation of this new program, and 113 have been granted registrations already. Since March, just before the implementation of this new program, we've had 1,200 doctors, nurses, and allied health professionals that have expressed interest in working in British Columbia. It could be attending a webinar or accessing information about how to apply to work here. We're going to continue to ramp up these recruitment efforts, including direct ad campaigns down the west coast of the United States through Oregon, Washington, and select cities in California. Our goal is to ensure that we're not missing this opportunity, to ensure that we're strengthening our healthcare system for all British Columbians. This recent development in relation to nurses builds on work that we've already done to recruit internationally trained health professionals. We have recruited over 1,900 international medical graduates that have registered in the province between January 2023 to April 2025. And over 1,600 internationally educated nurses have registered from January 2023 to the end of last year. Over the last 2 years, we've added 1,000 new family doctors, connecting hundreds of thousands of British Columbians to the primary care that they need. And we know there's a lot more to do, but we also know that there's an opportunity here to really ensure that people get the care that they need. We're continuing our efforts to recruit and retain and train healthcare professionals, including at the new medical school at SFU Surrey. My message to Americans who are watching this is very straightforward. In British Columbia, you will be valued, your principles will be respected, and you will have the opportunity to provide care to people not based on how much they earn, but based on the level of care that they need. You'll be part of building healthy communities in the best place on earth, and you are very welcome here. I say just briefly, President Trump's loss is British Columbia's gain.